5 signs and symptoms that your period pain isn't just cramps. Let's talk about it. Endometriosis and PCOS. Let's talk PCOS. And remember, PCOS, polycystic ovary syndrome, is from a hormonal imbalance that can lead to irregular periods. Severe pain in the periods, that's less common with PCOS than it is with endometriosis. All right, so here are 5 signs and symptoms that could be leading to a diagnosis of PCOS. Number 1, irregular periods or absent periods. If you have PCOS, you can have long gaps between periods, like way more than the 28-day cycle, or you can just really have no periods at all. If this happens, always consult with a doctor because, yes, it could be PCOS. It could also be pregnancy. Consult with your doctor. Number 2, excess hair growth. With PCOS, women and even young girls can get hair growth in places where they don't necessarily want it. I'm talking about growing hair on your face, your chin, your chest, your abdomen. And so if you are unusually hairy, don't just go grab a razor or get electrolysis and just kind of move on to the next thing. Consult with your doctor because this could be a sign leading to a diagnosis of PCOS. Number 3, severe acne or oily skin. So yeah, if you're getting all kinds of pimples, cystic acne, oily skin, and I'm talking about acne that persists even past the teen years, that could be the PCOS. Remember, PCOS is a condition with abnormal hormones. You have excessive amounts of testosterone or androgens, and this could lead to severe acne. So make sure that you look at this acne as a sign, not just to go and get some, benzoyl peroxide or Clearasil or whatever acne treatment that's over the counter. No, if it's severe, consult with your doctor. You could have PCOS. Number 4, weight gain or difficulty losing weight. I know you hear me now. Yeah, if you have PCOS, you oftentimes have weight gain, usually in the midsection or around your abdomen, okay? So you can get increased belly fat. And here's the significance of increased belly fat. When you have a high adipose tissue or a high waist to hip circumference, then you are at increased risk for insulin resistance. And oftentimes patients with PCOS will have insulin resistance. When you have insulin resistance, that means that you are more likely to develop prediabetes or diabetes, okay? So you might notice that your hemoglobin A1C is elevated. Be sure to watch my video on diabetes explained after you finish watching this video. So here's how things might make sense. If you've already been told that you have PCOS, your doctor may have prescribed something called metformin. Now, metformin is typically a diabetes medicine. You might be thinking, I don't have diabetes. Why is my doctor prescribing metformin? Well, if you have insulin resistance, then the metformin can help with that and give you more insulin sensitivity and make it less likely that you'll develop high blood sugar or diabetes. Number 5, thinning hair on your scalp. Yes. With PCOS, remember, you have the high androgens, the high male sex hormones like testosterone, and this can cause you, even as a woman, to have what looks like a male pattern of baldness, okay? So you might lose hair at the crown of your head, you might get a receding hairline, and it's kind of a wreck because you're losing hair on your head and you might be gaining hair on your face and your chest. But nevertheless, make sure you consult with your doctor because there are treatments. All right. So if the signs and symptoms I'm talking about when it comes to PCOS seem familiar, okay, if it's ringing a bell, let's talk about when to see your doctor. If you are having very long lengths between your menstrual cycles, if they're persistently lasting more than 35 days, or if your menstrual cycles are just absent. Also, if you are noticing that you're having severe acne that's not getting better with simple over-the-counter treatments, if you're having hair loss or thinning hair on your scalp and excess hair on your face and chest, as we discussed. If you're having these symptoms, then make sure you talk to your doctor. And here's what I want you to mention when you go in. Outright let them know that you've been educating yourself and you think that you could have PCOS. So ask for certain hormone tests like testosterone or DHEAS, okay? Ask them for a hormonal panel that can let them know whether or not you have PCOS. Ask for certain hormone tests such as testosterone, androgens. Also ask when it's appropriate for you to have a pelvic ultrasound. Oh, it's also important to see your doctor if you get severe sudden pelvic pain, because with PCOS, you can get ovarian cyst rupture. So if this happens, it's another time to see the doctor. And again, ask if it's appropriate to have a pelvic ultrasound. Also, ask about the treatments for PCOS. And if you are planning a family and if you're having some infertility, or if you anticipate that you could have infertility, go ahead and start that conversation and ask your doctor about your treatment options. Question: which sign from today's video felt most familiar to you? Please comment down below. All right, so we talked about when to see a doctor for endometriosis, when to see a doctor for PCOS, but here are some red flags that your symptoms might be an emergency, okay? So if you're having these symptoms, I want you to call 911, call your doctor right away, seek emergent care, okay? If you're having fainting, okay, you could be having such heavy bleeding that you're anemic to the point of passing out. Also, if you're having fever, you could be having infection or some type of an ovarian abscess or something of that nature. So a fever is not one of the run-of-the-mill symptoms. Also, if your periods are so heavy that you're literally soaking through feminine products or soaking through to the point where it's soiling your clothes frequently, maybe even every hour, if the bleeding is heavy like that, or if you're passing blood clots, okay, then I want you to seek immediate care. Also, if you have a positive pregnancy test with pelvic pain, please seek immediate care because you could be having an ectopic pregnancy. Some people refer to ectopic pregnancies as tubal pregnancies. It's important that you start tracking your symptoms. This will help your physician to better diagnose and treat you. So make sure you start taking notes. You can write it down. You can put it in your smartphone. Take notes on the severity of your symptoms. On a scale of 1 to 10, 10 being the worst, how bad is the pain? Is it cramping pain? Is it stabbing pain? Make a note on the calendar where the pain is in relation to your actual menstrual cycle. Talk about how far apart the cycles are. Make sure you take notes on if you are having pain during bowel movements, pain with urination, pain during intercourse. When you see your doctor, make sure you take a list of your top concerns. Be sure to write them down. Sometimes you can get discombobulated when you start talking to the doctor. And also include in this list treatments that have helped, treatments that you have not responded to. Be very detailed in order to help your doctor to help you. It's very important that you advocate for yourself. If you think you might have endometriosis or PCOS, you want to make sure that you are heard and that you are not ignored. So using some of these self-advocacy phrases might help. If this applies to you, say something like, "These symptoms are keeping me from performing my daily activities. I would like a full workup, please." Or, "These symptoms have lasted for more than 3 cycles. Can we discuss imaging or referral to a specialist, please?" Or, "What is the next step if this first treatment does not work in 6 to 8 weeks?" Make sure that your doctors know that you are a thinking person and that you want them to be thinking about plan A, plan B, plan C. As far as treatments for endometriosis and PCOS, you definitely want to consult with your doctor. And for endometriosis, you may be offered pain management like NSAIDs, heat. You might be offered hormonal treatments. Also, pelvic floor physical therapy. Yes, that's a thing. As far as PCOS, definitely physical activity. You might be offered medications like metformin if you have insulin resistance. Also, hormonal treatments like contraceptives. And for both of them, you may be referred to a fertility specialist if you do develop infertility due to these conditions. So there you have it. I hope you found this breakdown of endometriosis versus PCOS to be helpful. And if you heard yourself in any of these signs or symptoms, please be sure to advocate for yourself and consult with your doctor.